Well, thank you all for coming to see me. It's such a beautiful afternoon. I'm kind of wondering what we're all doing inside. So of course, I'm going to be talking this afternoon about what you can do for your joints. So why don't we get right into that? And you know, one of the first things I think it's important to talk about before we talk about what you can do for your joints is, well, what is actually causing pain? You know, I get that question a lot, like, what's causing my pain? So it's important to know that in the musculoskeletal system, so you know, extremities and back and things, there's a number of different structures that people can run into troubles with. So, of course, we're going to talk about arthritis, but many of you guys have probably heard of these other things. So just a little bit of sort of lay of the land here. So here's a tendon. This is a quadriceps tendon in this case. This is connecting muscles, the big muscles of the quadriceps, to bone. And in this case, it's to the patella and wrapping around and coming down to the tibia. So of course, people can get tendonitis for irritation or injury to that tendon. People can also get something called bursitis. So a bursa is a little sac of fluid that tends to be either under or on top of structures that provides a cushion. Usually it's very, very, very thin and something that you can't particularly feel, but if it gets inflamed, it actually can get quite large. And probably someone in this room probably had at some point patellar bursitis, where they had this big sort of puffy knee and this kind of squishiness over the front. And so that's an inflamed bursa. And then people, of course, can get muscle strains. So the muscle itself back up here can get injured as well. So those are all different forms of pain, different structures that can get involved or damage that can lead to pain. And just some examples of that you probably all have heard of at some point. There we go. So here, of course, people have probably heard of tennis elbow, or the formal name being lateral epicondylitis. So that's often a pain on the side of the elbow. And actually, most of the time, it's not necessarily from playing tennis. It's just simply the tendon, as it inserts into the bone there, can get irritated, particularly in people who are doing a lot of work doing something that's grabbing something heavy. And that's part of the reason, or grabbing very tightly. And that's part of the reason why tennis is such a problem, because it's not necessarily the swing. It's actually holding the grip of the racket. Another example of tendonitis is, of course, rotator cuff tendonitis. So everyone's probably heard of that at some point. And it's a very, very, very common problem. People often will have shoulder pain. And more often than not, it's not actually arthritis. It's actually a little bit unusual to get arthritis in the shoulder. It's much more common to actually have rotator cuff tendonitis. Often the pain is on the side of the shoulder and kind of going down the arm. Often it hurts a lot to reach above one's head. And that can be involving the muscles as well as the tendons here. Another example is ankle tendonitis, and particularly Achilles tendonitis. Probably many people at some point have had some discomfort in the back of their heel. And that, of course, is the Achilles tendon connecting the gastroc tendons down to the heel. Or sometimes people get plantar fasciitis, which is a kind of tendonitis, along the bottom of their foot. Some people have more pain on the outside of their ankle as well. That, too, is actually rarely arthritis. More often, that's the tendons coming down the side of the ankle and inserting down here. And then finally, one other example of tendonitis, and particularly a bursitis, is hip pain. So very commonly, people come to me and complain about hip pain. But in truth, the actual true hip joint is deep inside the groin. So usually, if people are talking about pain on the side there, it's actually either the bursa that's protecting the bone here on the side of the trochanter, or it's the muscles from the gluteus coming down and inserting down here, which are helping to stabilize our pelvis when we walk. And it's very common to actually get a strain of those gluteal muscles or irritation of that bursa, so that pain that you're feeling on the side of the hip is actually more often either a bursitis or a tendonitis. So those are just some examples of tendonitis, bursitis, and muscle strains that people experience all the time, and that's just a little bit different than arthritis. Okay. So I think people have sort of seen hands like this. Disney's made them famous on witches. And you kind of see these kind of large knuckles, in this case, over these end knuckles, and these knuckles called the PIP joints. So what's going on here? What is arthritis? So you can kind of see this, OK? All right, so here is a normal joint over here. So we'll start with the normal one. So here's the bones. And this you can imagine is any joint in the body, but you can imagine this is a finger. And so here's the finger bone, and here's another finger bone. And over the surface of the bone is some cartilage. And the cartilage is basically providing a cushion for the bones. It's providing lubrication. There's a lot of water in cartilage to make it soft and pliable. And it allows the joint to actually function quite normally and take the impact on it. Coming around the joint is the joint capsule. That makes it a sort of a pocket inside. There's a little bit of fluid inside, but not too much. Although if the joint gets irritated, that can fill up. And there's a number of different sort of fibrous ligaments on the outside keeping the joint stable. So in arthritis, what happens, and particularly this is more osteoarthritis or degenerative arthritis, where the cartilage wears down in time. And the cartilage can wear down for many different reasons, but wear and tear is one of the most common. And so in this case, what you can see is that most of the cartilage is gone, and now what you have is much more of a sort of situation where you have bone rubbing against bone. And of course, that's uncomfortable. As a response to the bone rubbing on bone, the bone doesn't like that, and it reacts. And one of the ways it reacts is it tries to increase its surface area by throwing up these little bone spurs or osteophytes. So these spurs kind of come off the side of the bone, making this a little bit wider. And that's actually, if we go back for a second, what those sort of larger knuckles are. Those are actually reflecting those bone spurs. Okay, so bone on bone is arthritis. And I'm going to spend a lot of time talking about osteoarthritis, or plain old regular degenerative arthritis. I'll talk just a little bit about the other forms of arthritis, like rheumatoid arthritis, that can lead to this as well, damaging things much more quickly. Okay, so osteoarthritis, though, has some characteristic locations. It doesn't affect all the joints in the body necessarily, but there's some that are more likely to be affected than others. So, of course, one of the most famous ones, of course, is the hands, and I just showed the picture of that. So some other joints that can be involved is the big toe, from spending a lifetime of putting all that pressure and walking and pressing off the big toe. The hip, of course, very common. The knee, very common. And the spine, very common, particularly the lower back spine, the lumbar spine, or the neck spine, the cervical spine. All places that are commonly involved in osteoarthritis. Some people have many different places involved. Some people will just be one or two. Now, in truth, any joint in the body can be involved in osteoarthritis, but it tends to be more for specific and unusual circumstances. So I had mentioned before that it's actually unusual to get shoulder osteoarthritis, although if you spend a lifetime of doing some repetitive motion with your shoulder that can injure the shoulder, that can lead to osteoarthritis. So actually, professional baseball pitchers very commonly have arthritis of their throwing shoulder and throwing elbow. So if you had some sort of occupation that put a lot of stress on some particular joint, that's more likely to lead to osteoarthritis at those locations. Another reason that can lead to osteoarthritis is injury. So it's very common that people talk about, like, my bum knee. Well, what's going on there? Why do they have a bum knee? Well, usually what happened is that they had some injury many years before that actually did a lot of damage to that cartilage. And in time, that cartilage, the damage to it continued to accelerate, losing that joint space and now leading to a lot of osteoarthritis. So usually when people talk about a bum knee, it's usually describing osteoarthritis that was often accelerated by some injury previously. Some other things that can lead to osteoarthritis, so of course age. So it's much more common in people over the age of 45 or so. And usually the longer you go in life, the more likely you are to have osteoarthritis at some location. A family history. This is particularly important for people who have a lot of osteoarthritis in multiple places, particularly the fingers and the spine. And so it will often be handed down from grandmother to mother to daughter. This is actually a much more strongly inherited form of arthritis than any of the other kinds of arthritis, like rheumatoid arthritis. Osteoarthritis is a little bit more common in women. It's more likely to develop osteoarthritis if there's a lot of stress on a joint, and so particularly being overweight is going to lead to more likely to develop osteoarthritis in the hip or the knee. And then, as I mentioned before, the prolonged occupational stresses. So finally, we get to, what can I do for my joints? What can I do to keep them healthy? Now, the stuff I'm going to talk about is no secret to anybody in the room. But hopefully, as I talk about this, there'll be some tips that you'll find helpful that will allow you to keep your joints healthy. So we'll start with exercise. No surprise there, right? Everyone knows we're supposed to exercise. All right, well, let's talk a little bit more about what kinds of exercise. Well, so there's always a range, and there's differences for everyone in the room. Some people have been spending their whole life running marathons, and that's awesome, and they're fantastic shape. And so for them, I'm maybe not talking as much about low-impact exercise. For some people, you know, you spent a whole lifetime behind a desk where you're too busy to really think about one's body for a long time, but you've finally gotten to the point where you're like, geez, I really should start taking better care of myself. What can I start now? So going through this list, you know, you want to take away what you think is going to be right for yourself. So some important points. So strengthening and aerobic exercise both have a role. One of the more important things is actually aerobic conditioning, endurance exercises, and the most simple of which is just walking. But there's also a role for strengthening exercises to build up the stability of one's joints. And so those can be things like building up the leg muscles. Along with strengthening can also be balance exercises. Doing exercises with a coach, working on keeping one's balance doesn't seem like a big deal. But actually, you know, if you happen to be walking down the street and trip over the sidewalk, actually having more strength and more balance can save you from hitting the ground. So I always encourage people to think about not just one kind of exercise, but multiple different forms of exercise to build up all the different kinds of muscles in the body, and both the strength ones as well as the distance, endurance, conditioning ones. Low-impact exercise we tend to emphasize as being a little bit more gentle on the joints. Although that being said, people who spent their life running don't have a higher incidence of hip or knee osteoarthritis than people who didn't. That's not necessarily true for those ultra marathoners, the people who run 100 miles. That tends to get more into that repetitive, the over and over stress of the occupational damage. But in general, we tend to push people in more sort of lower impact things. And so when I'm thinking about that, I'm thinking about walking, I'm thinking about bicycling, I'm thinking about stair steppers or elliptical machines, things that aren't quite as jarring. So walk, bicycle, swim, all great things. Aerobics is also a great thing. A little bit more. How much? So again, if you've been spending a lifetime of doing 2 hours of exercise a day, then obviously this slide's not exactly quite right for you. But if you're not someone who's spent a whole lifetime of doing a lot of exercise and you're looking for ways that you can increase the amount of exercise, here's some tips. So what you should be aiming for is at least 30 minutes a day. But when you first get going, I can't emphasize enough starting slow. So over and over and over, I'll see people in clinic and we'll talk about doing exercise, and they're really motivated, and they'll go out and do an hour of power walking, and then they'll do it again 2 days later, and then I get a call from them saying that I've never been in more pain, and I spent the last week on my couch and I can't move. So just be mindful of that. But you want to, so one of the things I kind of coach people in doing is creating a plan. So what are you going to do this week? Well, I'm going to get out and do 10 minutes of walking on Monday, Wednesday, and Friday with my friend Jean, and then my daughter, and then my husband. And then next week, I'm going to push that up to about maybe 15 minutes, you know, and work it up, and actually put it in people's calendars so they're gradually working up. So that reminds me that it's always a good idea to get support. Classes are a great way of supporting yourself in actually showing up and doing the exercise. You also get coaching from the instructor. Hopefully it's an instructor who's mindful of your abilities and doesn't give you something too hard, and usually instructors are pretty good about that. The other thing that can be helpful is not just classes, but groups. There's so many different walking groups out there, and it's awesome. It's so great when people have the support of a group to actually get them out. You're so much more likely to get out when you have someone else who's expecting you to show up. Okay, what kind of intensity? Again, for someone who hasn't been doing tons of intense exercise, what you're kind of going for is a light perspiration, and you notice that you're breathing a little heavy. So it shouldn't be this gentle walk in the park. No, you're out there to get exercise. So you're trying to push yourself just a little bit beyond what's easily comfortable so that you notice yourself being a little tired by the time as you're going. You should be able to keep on breathing and speaking easily. And don't forget that usually when people are exercising, it's the first 10 minutes where you always feel more tired, more exhausted. You always feel like you're breathing heavily. The body seems to have to kind of get in the groove of things. So don't get too alarmed in those first couple of minutes. You're like, oh my God. Back off a little bit, but keep going. Okay, some safety tips. So start low, go slow. I cannot emphasize that enough. Warm up, cool down. So I'm a big believer in warming up. What I mean by warming up is some gentle stretching. Maybe, if you're actually really achy, some people actually even take a hot bath or shower before they get going, or put a hot pad on. That can be really helpful for loosening up the joints and making it a little bit easier to start going. And then the stretching is so important to help prevent injuries. So if there's a part of your body that's particularly achy or sore when you're exercising, great idea to work with a physical therapist on some exercises for that area of your body to loosen it up so it's a little bit easier to get going. Temporarily stop. Wrong button. Temporarily stop if it causes pain. So there's, for many people, they're good at listening to their bodies, but particularly the guys, keep going. Don't do that. So that's my dad. He often will say, well, yeah, there's a little bit of soreness, but it'll be okay. And next thing you know, he's torn his calf. But he's learned that, you start to feel pain. That's a sign that something's wrong. Stop and see and give it some time to rest. If it's still hurting, don't go back the next day and start and power through it again. You're likely to cause some damage. And consider getting a coach. And I can't emphasize this enough. There are so many physical therapists and personal trainers out there, and they really have a lot of skill and a lot of experience at directing people and sort of putting people on the right track. So I really want to emphasize that whether it's just an area of your body that's more sore, talk to your doctor about a referral to a physical therapist. If you have the means, get a personal trainer. But whatever approach you take, I find this so helpful in getting people pointed in the right direction to a kind of exercise that's comfortable and they feel good when they're doing it. Okay, what can I do to keep my joints healthy? Diet. So we all know we're supposed to eat well. Well, what does that mean? Okay, so one of the most important things, of course, is being overweight. So we all know it's not good being overweight. It's hard on the joints. They wear down more quickly, and you feel worse. So it's always important to try to be on top of one's weight. And of course, it's incredibly difficult to lose weight. So if you're interested in losing weight, which is great, programs work best. So having the support of a program seems to be important. So a lot of different medical studies have been done on which kinds of programs and which kinds of diets. There's a little bit of evidence to suggest that things like Weight Watchers and Jenny Craig might be a little bit more helpful than some of the others. But all of the programs have a similar effect. And so usually with most of the programs, they help people to lose roughly 5% of their weight over the first couple of months. And then they are helpful for keeping that weight off. Now, of course, it's challenging keeping the weight off. And many people who engage in programs ultimately end up gaining that weight back over a couple of years. But I think part of it is that being in it for the long term, sticking with the program. That's always so hard and it's so important. What kind of diet? There's all, you read about all these different kinds of diets. The Mediterranean diet, the Atkins diet, the low protein diet, the low carbohydrate diet, all these different diets. Well, that's been studied. And the truth is, there's no one diet for everyone. What a surprise. It would be outrageous for me to say that everyone in this room had to eat the same things. It just doesn't make sense. So one of the things I very much found is that people just need to figure out what's right for them. So some people, it will be a low-protein diet. And some people will be a more low-carbohydrate diet. Some people feel better when they don't eat gluten. Some people feel better when they don't eat dairy. Some people feel better when they're on a Mediterranean diet. What I encourage you to do is to try it out. Try it out. Give it a month. See what happens. If you feel better, stick with it. If you don't feel better, go back to whatever you're doing before. That's what I see over and over and over. Often people will try something, and at some point they hit something that really makes them feel good. And I think the other thing about that is just being conscientious about what we put into our bodies can make a difference. So when people are thinking more about how to keep themselves healthy, I think it translates into people feeling more healthy. So I can't emphasize enough. So I don't want you guys to walk away from today saying, well, that academic doctor from UCSF said no diet makes a difference. No, no, no. I'm just saying that there's no one diet for everyone, but I think diet actually does make a big difference. Okay. So vitamins and nutritional supplements, I get asked about that all the time. This too has been studied a lot, both vitamins and nutritional supplements. And it's a little bit depressing to know that actually no diet and no nutritional supplement has been shown in large studies and repeated in other studies to actually lead to any positive outcome for people. It's a little bit of a bummer. You know, and this has been tried for preventing heart disease, for preventing cognitive decline, for treating arthritis. And one of the big ones for treating arthritis was glucosamine and chondroitin. And there was a trial that was published that everyone was excited about, showing that actually people had more cartilage and more space between the joints. When it was repeated, the whole thing went away. So I always discourage people from getting too wrapped up in this. And in fact, you know, if you kind of keep track of the news, there's many reports of actually whatever was advertised as being in this pill with chondroitin or glucosamine actually turns out to be something else, like just radish root. So I would be cautious about these things. And there's many reports over the last couple hundred years of actually some of these things containing stuff that's actually dangerous. So every now and then you hear about some terrible story where a whole bunch of people took some supplement and ended up in the hospital. So I actually would be a little bit cautious about it. And it's impossible to predict from where you got it from. GNC is not necessarily better than anywhere else or Whole Foods or whatnot. Vitamins. So a multivitamin is not a bad idea, although in truth, there's no scientific study to actually prove that it actually prevents people from running into problems. I think as long as you have a healthy diet, that usually is enough to supply all the vitamins you need. Although if you have a very narrow diet, you might consider adding a multivitamin. Many people don't get enough calcium and vitamin D in their diet. So I encourage people, particularly postmenopausal women, to consider some calcium and vitamin D supplementation. And usually that's the oyster shell calcium with vitamin D. But if you happen to be on one of these acid-suppressing drugs, then you want to switch over to calcium citrate. Some vitamins can be a problem if you take too much. So a couple of different studies have been done with beta-carotene and vitamin A and vitamin E, and that actually showed that people actually could run into toxicity problems. So I definitely encourage people not to go overboard, to follow the USDA recommendations for vitamin doses and not to go beyond that. Okay. So when should I see a doctor? When is it, boy, this knee pain is just killing me. Like, when should I go see a doctor? All right, so two kinds of things to think about as you're thinking about trying to decide whether you want to go see a doctor. All right, so one thing to be mindful is, when is arthritis not just plain old regular osteoarthritis? When is it something else? When is it rheumatoid arthritis? So one thing that could suggest that, if you have many, many, many joints involved. So it's not just a knee and your fingers, but it's actually the fingers and the wrist. The wrist is not often involved. Base of the thumb can be involved, but not the wrist. That's unusual. It's, as I mentioned before, a bit unusual for the shoulders to actually have osteoarthritis. Certainly very unusual for the elbows. Unusual for the toes as well. And of course, sometimes people will develop very swollen ankles when they have a lot of arthritis. So when people have multiple locations of arthritis, that could be a sign that there's something else going on, and that's worthwhile going and checking and asking your doctor about it. And so one of the things we're concerned about that would be something like rheumatoid arthritis. So that's the autoimmune condition, unlike a wear and tear type degenerative condition. That's an autoimmune condition where the body's own immune system is attacking the joints and causing inflammation. And then you can get that in rheumatoid arthritis. Some people get that when they have a skin condition called psoriasis. Some people can develop lupus. There's a number of different conditions that can cause an autoimmune attack on the joints and cause a lot of swelling and pain in many different joints. The other thing that people often develop, particularly later in life, maybe not often, but it's often is regularly seen, is a condition called polymyalgia rheumatica. So that's a condition where people go from the usual sort of aches and pains when they get out of bed into the morning to just struggling to get out of bed in the morning, where people have profound stiffness. And it's not the kind of stiffness where it just hurts to get out of bed, but you get out of bed, you take those steps, you go to the bathroom, you brush your teeth, maybe you take a hot shower, you have some breakfast, and only after an hour or multiple hours are you starting to loosen up. So a stiffness that particularly affects the shoulders and the lower back and the thighs, so a lot of the body, and is going on and on and on, and a big change. That's something to consider that as a sign that something else is going on, and that's a reason to go see your doctor and ask about that. Okay, what are some other reasons to go see a doctor? So this is more related to osteoarthritis, and when is it worthwhile to go talk to your doctor about osteoarthritis? So persistent and worsening pain, and particularly if it's affecting your activity level. I really want to emphasize that. So, many of us have some sort of pain that you just kind of live with. But if you start to notice that what you're doing is dropping off, that's a good time to go see your doctor. So again, going back to the example of my father, he was playing tennis, he's doing great, but this tennis game's slowing down, it's harder to get across the court, and finally, after a while, he found he just couldn't do it, and he just kind of gave up. At that point, I said, Dad, I think that's time for you to go see your doctor. Okay. Another reason to go see your doctor is if you're taking over-the-counter medications all the time. So I'll come to a little bit more about the medications, but things like ibuprofen, so Advil, Motrin, if you're taking that all the time, that actually could lead to some problems. And so that also should be a tip to you that you should be getting some professional advice. And then finally, if you're just concerned about it, if this is just kind of weighing heavily in your mind, like what's going on, I definitely encourage you to go talk to your doctor about it. Okay, so some medications. So here's a list of medications. I don't want to spend too much time on medications. I think this is a better conversation for you and your doctor. But just here's a quick lay of the land for everyone. So my favorite medication is that one, Tylenol. Good old-fashioned acetaminophen. It is the world's safest drug. It gets a bad rap because so many people use it that every blue moon, somebody has some bad reaction to it. But for the most part, when you take Tylenol the way you're supposed to take it on the bottle, it is incredibly safe. Now, of course, I think we're all familiar with the fact that Tylenol is not the world's strongest medication. And often, when you're in a lot of pain, it doesn't work well. Sometimes people find it a little bit more effective when they're taking it all the time. So if you have just a lot of hand pain all the time, your fingers are just constantly achy, sometimes taking Tylenol 3 times a day can be a little bit more effective. NSAIDs. So that means ibuprofen, so Motrin and Advil. Aleve, which is called naproxen. And there's actually this drug called diclofenac. You can't buy it over the counter, but it actually comes with a gel that you just smear on your joints. So these are all great medications for pain, but they all can have side effects. Incredibly common for people to develop stomach ulcers when they're taking these medications regularly, particularly if you're taking it on an empty stomach. They also can be hard on the kidneys and occasionally the liver. So so these are really effective medications, but you do have to think about them with some degree of caution. And if you're on other medications, there can be interactions as well. So I definitely encourage you to talk more about with your doctor if you find yourself taking these regularly. Tramadol is a stronger medication. It's a little bit like some of these guys, the narcotics, where it has a partial narcotic activity. So it's not quite as potent as these, but it can be helpful. So some narcotics, codeine, hydrocodone, so that's Norco, and OxyContin. I'm not a big fan of these. These medications are extremely strong. They have many different side effects. They limit people's responsiveness. Technically, people really probably shouldn't be driving when they're taking these drugs. And often, if you have chronic pain from arthritis, over time, you'll notice that the medication loses effectiveness, and then you need to increase the dose. And so it's very common when people are taking these drugs regularly for arthritis to need more and more and more, and it's causing more and more side effects. So I just encourage people to be cautious about that. Great medications for acute pain when people are in tons of pain, not so great if you're taking it all the time. And then finally, something that you can go talk to your doctor about is joint injections. Now, in truth, joint injections actually haven't been proven to be helpful over the long term. But joint injections do help many people for acute pain, and I do recommend them when people are having a lot of pain that's preventing them from doing other things for the joints, like getting into physical therapy and working with a physical therapist. If you're in so much knee pain that you just can't work with a therapist, it's a great idea to talk with your doctor, either an orthopedic surgeon or your primary care doctor or a rheumatologist about joint injections. Okay. Last couple of things. Joint replacements. Of course, when is a joint replacement right for me? So joint replacement is often helpful for more severe arthritis, bone on bone, as you can see here, as opposed to the normal joint with the cartilage space there. So you've lost the joint space there, bone on bone. So joint replacements are good for the hip and for the knee. Other joint replacements have been worked out for other joints as well, but they're not as proven to be as helpful. So how do we turn ourselves into the $6 million man? All right, so as I mentioned, the knee and the hip, timing. So people are always asking me, when's the right timing? When should I think about this? So that's actually a really difficult question to answer. It's been studied a lot, and no one's actually entirely certain about it. Here's my take on it from working with a lot of people, that it's better not to wait too long. People always say, yeah, I'm going to wait as long as possible. I'm not sure that's the right thing to do. And the reason is that when you wait as long as possible, often at that point, you're no longer doing all the things that you love doing. That's not great. And people often then are spending a lot of time in bed or on the couch, and they're losing muscle. And one thing that's hard to do as you're getting older is to gain that muscle back. So I think waiting until you're barely moving at all is waiting too long. So what I tend to tell people is when you're at the point where you've done all the different things you can do, you've taken the medications, you've gone to physical therapy, you're doing all the exercises, and yet your activity level is still dropping off. So again, back to the example of my father, no longer able to play tennis, no longer able to do a lot of sort of outdoor stuff he liked to do. At that point, he still didn't have so much pain that he was spending all his time in bed, but he wasn't doing the stuff he really enjoyed doing. That was the time to get a joint replacement. So what you can do ahead of time, and what he did ahead of time, is he spent a lot of time in the gym working on his leg strength. Now, in truth, there's no studies that actually prove that's definitely the right thing to do, but I have a lot of anecdotal evidence that people who spend a lot of time working on leg strength, working on the range of motion of their joints, spending time focusing on building up their body prior to the surgery seems to be a helpful thing in terms of recovering. What you can expect, certainly from a knee replacement, you're only going to be in the hospital just a couple of days. You'll probably be in a good amount of pain for about a few weeks, maybe a month. Usually people are back to doing a lot of different things after about 3 months later. Now that being said, if you wait really long and you're in so much pain that you just can't stand it, well, what I hate to say is I've seen many people who get the joint replacement, but if they're not really active beforehand, they don't tend to be really active afterward, and often they continue to have a lot of pain. So it's not guaranteed that the joint replacement is going to cure all the pain. But I have a sense that it's more likely to be less effective if you're waiting as long as possible. So not to say that, have a little bit of pain, go talk to your doctor. But if you're noticing that you're having so much problem with the joint that you're really starting to drop off in your activity levels, that's the time to go start to talk to someone. Okay, last couple of slides. Injuries. This happens, right? Things happen. Things happen in life. We run some bumps. So what should we do about it? For the first thing to know is, acutely, you stop what you're doing and you treat it. So everyone's probably heard this acronym before. So rest, ice, compression, elevation. So the key things there is the rest and the ice. Very helpful. So ice is a good thing when you're in acute pain. It reduces inflammation, helps to recover a little bit faster. Later on, heat or ice can both be helpful. In general, it's just different for different people, but in general, the heat tends to help people to get moving. Ice is more helpful for pain. Consider working with a physical therapist. Again, I can't emphasize enough how important it is to have a coach. If you have persistent pain, shoulder pain, knee pain, anything, back pain, it can be so helpful working with a physical therapist. When you go see the physical therapist, they should be giving you exercises to do. In general, my experience is that if you do the exercises every day, people usually notice improvement. If you're not doing the exercises every day, then I encourage you to reconsider. Because it's so often that people come in to see me and say, yeah, I'm still having all that back pain. Well, how often are you doing exercises? I did it a couple times this week. If you're going to do it, do it. All right, and then don't rush the recovery. Be patient. So don't forget, as people age, it takes longer to recover. Be respectful of that. Okay, so a final word, trajectory. So often people will come into my office and they'll be in a lot of pain. As things have gotten worse over the last month or two, and they're just so uncomfortable. And people are just dreading the thought, is it going to be this way for the rest of my life? And one would almost expect that, because we're talking about degenerative arthritis, and that's not going to get better. But the truth is that usually that's not the case. Usually life is ups and downs. And so very often people will come to see me when they're at the down. But usually by doing these different things, taking care of one's body, at some point, for most people, things will get better. I don't entirely understand the biology behind that, but it's so rare that each month will be worse than the next. So there's always hope. So try to hang in there, try to come up with a plan with your doctor, and try to take care of your body, and I suspect you'll get to a place where things are getting easier. Okay, so thank you, everyone. Thank you to the Arthritis Foundation, to UCSF, and the Rosalind Russell Foundation. Thank you. Absolutely. I think we're doing it so that everyone who's watching can hear the question. I think we're going to do some microphones.
I've heard a lot of things about boron being helpful. What do you could say about that?
Can you say that one more time?
I've heard some anecdotal evidence about boron helping joint pain.
I am not familiar with boron. I'm not familiar with it. I don't know.
On one of your slides about joint replacement, there was a prepare yourself.
Yes.
You didn't really say anything about that.
So what I meant about preparing yourself is spend some time with a physical therapist. So let's say we're preparing for a knee replacement. Spend some time with a physical therapist, and what they're going to work on is to strengthen your leg, and they're also going to work on range of motion. Because one of the things about arthritis is you lose a lot of range of motion, and then the joint doesn't work as well. So they'll work on those two things, building up strength, building up range of motion, helping you to be prepared for that, so that afterward you have all that strength and you have the range of motion, and that will help out the recovery.
Me. Hi.
Hi, great.
So I went to UCSF about the, UCSF is wonderful. And I went there for the spine, and he told me that for my spine I have serious degenerative disc disease, and he told me that it is not a good idea, such a good idea to have surgery for the spine because it could wind up worse than it was. And then I read a book also, or I'm reading a book also by Dr. Neil Bernard that says, that it's never a good idea to get spinal surgery because it wind up causing more problems. than anything. And also I had severe spinal pain and abdominal pain at the same time a couple of weeks ago, and it came all of a sudden as a surprise, and it lasted for hours. Is that because I haven't been getting chiropractic care lately, and I haven't been a member of a gym lately? Would that change radically once I join a gym?
So let me jump in. There are a couple things. So, all right, so great. I'm glad that someone asked about spine. So degenerative disc disease, so it's normal for the discs in your spine between the vertebrae to kind of squish over time and get flattened. And what that leads to is more compression between each vertebra, and that often leads to pain. So pain in the back or the neck from osteoarthritis, that does not respond very well to surgery. So if you're just having pain in your lower back or pain in your neck, usually surgery is not going to lead to much improvement in those pain levels. There is a role for surgery in osteoarthritis in the back, but usually the surgery is for when the arthritis is actually leading to pressure on the nerve roots. So everyone's probably heard of sciatica. So actually what sciatica technically means is the pressure on the S1, or sciatic nerve root, going down the back of the leg. And when there's pressure on that root, that root doesn't like it, and so you have that electrical shock type pain that usually goes all the way down to the foot. And with time, more and more pressure on that nerve will actually cause that nerve to die, and you'll lose the strength in your legs. That's not good. So the point for when there's compression on a nerve, or the other example is compression on a set of nerves in spinal stenosis, it is a good idea to have surgery to take that pressure off there. So that will relieve that shock-like sensation going down the leg, but that might not relieve the pain that you're experiencing in your back. Okay, so that's about surgery. Sometimes people get injections for their back. There's, just like for any other joint, the corticosteroid injections, the cortisone injections, aren't proven to lead to long-term relief, but can provide short-term relief for some people. And I encourage people to consider that if it's going to help them to then get into an exercise program. So if they're not able to do anything because they're in so much pain, get an injection, then able to work with a physical therapist, I think that's a good strategy. Chiropractors. So I have to be careful how I talk about what I say about chiropractors. I think one thing I have tremendous respect for chiropractors is their knowledge about the spine, their ability to sort of look at us, to give us tips about our posture, because mine is terrible, to talk about the exercises we can do. So all those kinds of things I think are really, really valuable from a chiropractor. Just like the steroid injections, I think manipulations of the spine, it's a little bit unproven in terms of long-term benefits of that.
Hello. Question about status of stem cell injections or hyaluronic acid injections or medical marijuana.
Got it. Okay, stem cell. Everyone wants to talk about stem cell injections. All right, so stem cell injections, so boy, that's such a loose phrase. There's all sorts of different kinds of stem cells in our body. There's easy ones to get a hold of from the bone marrow, but that's just for blood. There's other ones that are actually truly omnipotent, which can form any kind of cell in the body, but those are much, much harder to come by. None of these kinds of injections have actually been ever shown in a proven way to be beneficial in terms of building cartilage, regenerating joints. So no one's ever figured out a way to do that. There's lots of effort ongoing how to basically reconstruct the cartilage of a joint. I mean, fundamentally, that's one of the key things we're trying to do here. And we're still a long, long way away from actually being able to grow the cartilage and be able to put it back in a joint in a way that it actually functions, interacts with the bone, the whole thing. So other kinds of injections. So hyaluronic acid injections, so that's called viscosupplementation. It's kind of a weird thing to have done. You go in, you get these 3 injections, and it's a huge volume, usually for the knee. And so after you get it done, you feel like you're walking on this giant balloon because you have so much fluid in your knee. And then you go back a week or 2 later and you get it done again, and then a 3rd time. It's expensive, although usually insurance covers it. And the data on it is a little bit mixed. Fundamentally, the data supports it being helpful, but the improvement is mild, and it usually takes a long time for that improvement to be realized. So if you line it up against a placebo, Usually, there's not a whole lot of difference in the first couple of months, but 6 months down the road, people who've had the injections note a little bit less pain than the people who had the placebo. So, you know, if you're looking for options, I think it's a reasonable one, but you have to be patient, and the effect might not be very dramatic. I suppose I'll talk about one other hot topic. So platelet-rich plasma is something you'll read about in the news. Athletes are getting it all the time. That one also, the data is a little bit lacking about how helpful that really is. There was a lot of enthusiasm for it first, although the rationale for it I don't entirely understand. And there were some successes early on, but when studied in a couple of different trials, those successes have been sort of, well, mitigated. So I'm not sure that's necessarily the best way to go.
Last question.
Can anything be done for neuralgia?
What do you mean by neuralgia? Very sharp pain in the ankle. Very sharp pain. All right. So that's kind of getting into nerve pain. So nerve pain is much trickier. So just like sciatica, where there's pressure on a nerve, there can be many different causes to nerve-type pain. So nerve pain can come from dying of nerves that they're very sort of far away from the body. So diabetes will do that very commonly, where the feet will be on fire. Another kind of nerve pain is pressure on the nerve going through the wrist at the carpal tunnel, giving you carpal tunnel syndrome with that burning pain in the fingers. So some kinds of nerve pain, you can do something about. If there's clear pressure on the nerve, like at the carpal tunnel or at the back, then clearly you can make that better by taking that pressure off. But if the nerve is dying for some reason, diabetes or some other reason, that's much trickier to treat. Usually we're just talking about medications, special medications, to help relieve some of that pain. But that is a aggravating pain. So, all right. So the question is is there a cure for joint deformities? And she was pointing to a swan neck deformity, as a particular kind of deformity in the fingers. So deformities can happen from arthritis. So arthritis leads to damage to the joints. And so for people with more advanced osteoarthritis, you'll notice that the joints kind of have this sort of bendy look to them. So for the most part, for that kind of arthritis, that's a hard thing to treat. Sometimes we refer people to hand surgeons for corrective surgery when the deformity is actually interfering with their ability to use their hand. And so a specific example is if you have enough deformity to the thumb that you can no longer touch it to your fingers and form grip strength, then that's a time when you're thinking about having hand surgery. But for the appearance, that's not something we usually do.
We don't have time for any more questions now, because we move you on and thank our...
Thank you all.
Thank you.